Welcome to Merge TV, the place where you get expert advice on how you can beat fatigue. Today we're talking to wellness expert Giselle Cook, who has had over 33 years experience, treated over 1 million patients in practice, and who has a special interest in fatigue. So Giselle, tell me a little bit about how you developed this special interest in fatigue.
Well, out of necessity really, Kate, because my patients that were coming to me in my practice setting had been complaining of fatigue and tiredness and of all sorts of types. It might be mild fatigue, it might be intense drowsiness, it could be a chronic fatigue, and depending on what they were complaining of, there's always a different cause for each of those types of fatigue. Can be really simple, can be complex, but it's really necessary as a practitioner to investigate the underlying cause of fatigue, because there's no point in trying to use a stimulant to keep someone energized, which may or may not work, but then not address the underlying problem. It's just bad medicine to do it that way.
And I suppose a lot of people tend to resort to that.
Yes, that's right, the quick fix.
Yeah, absolutely.
It's very appealing.
Yes.
And sometimes a quick fix will give you that energy, but then there's often the slump after that, like a caffeine hit.
Yeah.
And the energy goes up, and then very shortly after that you feel even more fatigued because you've used up more nutritional resources and you're worse off than you were before.
So it's not really a long-lasting answer. It sounds like wellness medicine is, so can you explain a little bit more about that?
Yeah, exactly. That's the sort of thing that I like to do now. In wellness medicine, it's really trying to optimize the client's health, look at areas that may not be functioning well, so always looking at digestion, always looking at liver function. In terms of fatigue, there's 200 essential functions that the liver has to manage, and that's where we store our energy, that's where we remove our waste. So I often find starting at the gut and liver area is key for looking at underlying causative factors and managing the fatigue. So then you've got a more durable solution, and then you're getting into that area of wellness. So sustained wellness is what I'm really aiming for, rather than I'll get you out the door, make you feel a bit better today, and don't worry about next week.
Well, that sounds really balanced and a bit more long-lasting.
Yeah.
So what does that actually mean for people who are busy and fatigued?
Well, that's part of the problem. Of course, being busy causes more energy drain. So I think it's a little unrealistic sometimes when people want to keep going, and they may have a lifestyle where they're a mum with young children, and in the corporate world where I'm working now, having a lifestyle where it doesn't allow the recovery time. So what it really means is if you've got to keep pushing through, you're not going to be well. As simple as that. If you've got huge demands on your energy requirements, it's going to be finite, your capacity to restore your energy levels while you keep going. It's like if you want to do a cleanse or a detox program, you really have to do it over a weekend or a week off, but you can't expect your body to go into restoration mode and regeneration mode while you're still active. So as long as you keep burning the energy, you're going to be depleted. So it's stop, recover, recharge the batteries, and then get back on top again.
Yeah, but I can imagine that would be quite difficult for people to accept if they're busy and fatigued. Considering stopping and making a lifestyle change, that must be really hard for people to make that change. How do you assist people to make that change?
Well, if it's an impossible situation where there are huge demands, it might be a PhD student who's finishing up their thesis and they have to get it finished, well, then you just enable them to get through that period of time. But then I negotiate. I say, how much time do you need to keep operating like this? And I'll give you a remedy that will take you to that point. But at some point, you're going to have to say, well, I now need to give my body a chance to recover itself. And we're dealing with our physiology. It's not negotiable at some point. At some point, your body's going to say, I've had enough. I'm not getting out of bed today. You've just pushed me too hard, and today I'm taking a day off.
Yeah. So it sounds to me like the first step for people who are really busy and fatigued is to make the decision to make a lifestyle change.
Yes, that's right.
Okay.
And it is exactly hard as you say. For someone who's A-type personality, highly driven, focused on goals, it's really, athletes, very, very difficult to say, I'm going to change what I'm doing, because the head has an expectation of how it wants life to be. And it is talking to that, saying maybe this is not fair or reasonable to expect your body to keep pushing along when you don't give it a chance to take a breath. So yes, it involves doing psychotherapy in a lot of cases, and neuroemotional technique and techniques to shift the intention and the expectation that I can just keep running at this pace. So often that shift in expectation is what gives that person that breath and an opportunity to review how they've been operating. Because we've all got a different level of stamina. You know, we've all got different genes, different constitutions, and it's hard to compare yourself to someone else. Oh, you know, they're still going, why can't I keep up with them? We're all very unique. So embracing that uniqueness, trying to identify what we need as individuals to keep ourselves well. That's the key to the work that I do.
And you mentioned collaborating with other professionals. Can you talk a little bit around what that means for people who might be interested to come and see you, Giselle?
Yeah, well, like if I was just relying on my script pad to get people's energy levels up again, or maybe I could do it for a short time and maybe I could give them a medication that would just get them through a difficult patch. But I'm not going to be able to give them the level of wellness I could if I could also engage a massage therapist to take the tension out of the patient's body so they're not burning up energy in muscles that are tight. You know, an acupuncturist to release the flow of chi and just get the energy levels recovering. I do use bioidentical hormones for patients who are adrenally exhausted, and may use DHEA and sometimes even cortisol to resuscitate people who've really hit the floor. Other practitioners, chiropractors and even dentists, holistic dentists, sometimes a lot of tensions going on in the head and jaw area, chronic headaches causing fatigue. So there's quite a network of practitioners that I would call on with any one person who has a chronic health issue. Not always with a simple thing. You know, if it was just having had a recent infection and just trying to get well after that, a naturopath or a practitioner, an integrated practitioner could manage that. But when it gets to be a long-term complex thing, fibromyalgia, chronic fatigue, I think the team approach is the only way to really get a level of wellness, like really crack that point where, yes, I moved out of that chronic state of exhaustion, and then get to that level where, okay, now all the cells are firing.
Yep. And I guess ultimately people want to get the maximum benefit. So, you know, for our viewers today, I would imagine making a decision to change the lifestyle in some way, and then taking into consideration that maybe one practitioner is not going to be the solution, and having a team approach is the best way to go.
Yeah, very much so. Certainly when you've been dealing with something a long time, and sometimes health issues become layered. Like you might have started with a low-grade infection or a vaccination, and then you've got an allergy process starting up, and then you've got digestive issues, then you've got chronic stress because you're unwell. So it's a bit like we talk about peeling the onion in naturopathy, taking away the layers of the problem. And it may take a team to work in a coordinated way to really crack the code of that problem.
Okay. Well, that's really helpful, Giselle. I think that helps people to get a better understanding of what's important and what to look for. So, Giselle, we've talked a little bit about what's important for people to do in order to get ready to go on that health journey. What's the next step for people to do? How do they find the right people?
You definitely have to find your team, and it's always better if you're recommended to the right people rather than going through the phone book and trying to source it all yourself, or going to Dr. Google and trying to find your answers that way. I mean, that's it's a minefield.
Absolutely.
So I think if you've got a reputable resource, like there's the natural therapy pages and the Australian Integrative Medicine Association, who have their website, which is ama.net.au, and on that you can go and find a practitioner in your area. And the good thing about integrative medicine is you can find someone who's a doctor or another allied professional who has an integrated approach, so you know that they're going to know when to refer you on to other complementary medicine practitioners where their expertise finishes. So you then have the confidence that you're going to be having ongoing support from someone that works in an integrative way. And where I work at Elevate, we have a team of 22 practitioners, so we don't get short of someone to call in the door and say, can you give us a hand? So that's the sort of thing we do, is integrated. Well, that's integrative corporate health. And we do see all sorts of people, and most of our clients are fatigued for sure.
Yeah, well, that sounds really great, Giselle, and I think that has really clearly stepped out for our viewers today what they need to do in order to start their health journey, get their team together, and to feel confident in that process. It doesn't have to be scary, it doesn't have to be overwhelming, but it can actually be a positive process that you can regain control of your health and achieve what you're really wanting in life.
Well, I often find that people come in going, oh, I just feel so unwell and tired all the time. And by the time I've shown them the options that they have to get well, it's like, oh, this is a project, and I can get stuck into this now because I know where to go for solutions. And there are so many solutions for all the different types of fatigue. So it's really targeting the type of fatigue, getting very specific, and taking on the project and seeing it in a positive way. There is going to be a positive outcome out of this.
Yeah. Well, it sounds like the first and best port of call is education and gaining knowledge.
Yep.
And once you gain that, you can have a positive outlook on that health journey. So thanks, Giselle, for joining us this week. We really appreciate you taking the time.
I'm glad to speak with you, Kate.
Yeah, it's been fun. Well, that's it, guys, from Merge TV. Make sure you click on the links below. Check out ama.net.au, and also if you're lucky enough to live in Sydney, you might like to look up the Elevate website and book in to see Giselle Cook. See you next week on more lessons on how you can beat fatigue.